In this next scenario, we'll have chest pain, cardiac. Our EMTs are going to be Dan, who's our team lead, Kimberly, who's his team member. Kimberly has her notebook. You're allowed a blank sheet of paper to take notes on, because at the end you're going to have to provide a radio report. So we don't expect you to memorize everything. Either the team lead or the team member may take notes, whoever wants to. Ginny in the seat is going to be our patient, and Viri in the corner is going to be our proctor. So Viri, as the EMTs enter the station, how do we introduce the scenario to them?
All right, so you guys have a patient, a 64-year-old female, who is complaining of chest pain. They experience sudden chest pain while watching TV, and they also complain of slight shortness of breath.
Okay. So we're going to show up on scene. Is our scene safe?
It is safe.
Okay, we're going to put on our PPE. We have our PPE on now, so do we only have one patient?
Yes.
Okay. So hi ma'am, my name's Dan, I'm from UIC EMS. Can I ask you what's going on today?
My chest really hurts and I can't breathe.
Okay, we have a chief complaint of chest really hurts and I can't breathe. So can I ask you what your name is?
Bertha.
Okay. Can I ask you where you are right now?
On my couch.
Can I ask you what the year is?
2020.
Okay, and then can I ask you what was happening right before this?
I was watching The Price is Right and then my chest started hurting and I couldn't breathe.
Okay, so our patient is alert and oriented, 4 for 4. So now we're going to be moving on to our ABCs here.
Is ALS available? They're not.
Okay, so thank you for that, Kimberly. We always want to request our additional resources. So now we're moving on to our ABC. So
Patient also looks sick.
okay, great. So our patient is sick. Our patient was talking to us, so we have a clear airway. Okay, and we're moving on to breathing now. So our patient is already complaining of shortness of breath. So we're gonna, how fast is she breathing?
It's slightly rapid.
Okay. Is it regular?
It's regular.
Okay. And then Kimberly, could I get some lung sounds? Great. While you do that, I'm going to put on our pulse ox here. Okay. Could I have your finger, please? Thank you.
For me.
Okay, so what's our pulse ox?
You have a pulse ox rating of 91%.
Okay, great.
And then one more. And one more. Kimberly, what did you get for lung sounds?
I got clear lung sounds.
Okay. That's also true for the patient.
Okay, great.
What was the SpO2?
91%.
91% on our SpO2, great. Okay, so Kimberly, what do you think we should do for oxygen here?
Patient's having shortness of breath with an SpO2 of 91%. She looks visibly short of breath, so I would say lay non-review and ask it. High flow,
Okay.
15.
Great. So I think we're going to do what Kimberly suggested here. We're going to do our non-rebreather with 15 liters. So could you set that up for me, Kimberly?
Absolutely.
Great. Thank you. Okay. Let's see. Did we miss anything in breathing? So she is in respiratory distress. And I think that's about everything. Right, Kimberly? Vital volume, regularity, pattern. SpO2. Yeah, okay. So I think we're going to move on to our circulation. Do we see any major bleeds here?
No.
Okay, no major bleeds. And now we're going to check our pulse here. So I'm going to check the pulse on the radial side here. And what's our strength?
You have a strong pulse.
Okay, is it equal? We're going to check our equality just like this on both sides.
They're equal.
Okay. Is it fast?
It's rapid.
Okay. And then is it regular?
Regular.
Great.
Put this over the patient.
Okay. So we have our patient on oxygen now. Let's see what else. What's our skin conditions?
Pale, cool, and diaphoretic.
Okay. So at this point, I think we could safely say our patient is in shock.
Did we see any major bleeding? No.
No major bleeds. We're also going to do a cap refill here. So we're going to pinch our finger here. How's our cap refill?
The cap refill is under 2 seconds.
Okay, great. Let's see. So now we definitely want to transport.
I agree.
Okay. So we're going to load our patient up and we're going to start transporting now. Okay, so I think we should move on to our cardiac secondary.
Okay.
Okay. Does the patient have any JVD?
They do.
Okay, so JVD, do they have subcutaneous, pink frothy sputum?
They do not.
Okay, no pink frothy sputum. What's our skin conditions again?
Pale, cool, and diaphoretic.
Okay, and our pulse ox?
95.
Okay, and our lung sounds are still clear.
Correct.
Let's see.
Do we see any peripheral edema?
You do.
Okay.
Not. Oh, you don't.
There's no peripheral edema?
No.
Okay. Kimberly, anything else on the secondary there? Okay. So let's move on to, let's get some vitals.
Do you want to take a history or do you want vitals?
We could do the history first. Yeah, okay. So ma'am, how did this start? Did it come on really quickly, or has your chest been hurting for a while?
It was quickly.
Okay. So we have a sudden onset. So what makes it worse and what makes it better?
Nothing.
Okay, so it just always hurts? All right, and what does it feel like?
It feels like someone's like staying on my chest. There's a bunch of pressure.
Yeah, okay. What about, does it hurt anywhere else? Just your chest?
My jaw and my arm feel a bit weird.
Okay,
And should my chest too.
okay. How much does it hurt? If you were to put it on a scale from 1 to 10, with 10 being the worst pain you ever felt, what would you be at here?
It's a 10.
Okay. And then how long ago did this start?
Like 40 minutes ago.
Okay. All right. Do you have any allergies?
No.
All right. What about medications? Do you take any of those?
I take metformin, metoprolol, nitroglycerin.
Okay. What about what's your history look like? Do you have you had any cardiac conditions? Any other significant medical history?
I've had hypertension and diabetes and some heart attacks.
Okay. And then what did you last eat?
I had like cereal this morning.
Okay. And then right before this happened, you just said that you were just sitting watching some TV? Okay.
Any additional symptoms?
Okay. So at this point, I think we want to treat our cardiac issue here. So we're going to want to give we want to give 325 milligrams of aspirin. So first, have you had any recent surgeries? No, and you're not bleeding at all, right? Okay. So we're still going to give our aspirin. You're not allergic to aspirin, and so we're going to give 4 tablets. We're going to instruct our patient to chew up the tablets. Okay. And you said you were on nitroglycerin, is that correct? Okay, do you have that on you?
Yeah.
Okay. So we're going to confirm that this is their prescription, that it's not expired, it's the correct medication and the correct amount, okay? So this is the spray, so we're going to spray this.
We're going to take a blood pressure first.
Okay. So for nitroglycerin, we want to make sure that our systolic is above 90. So first, let's take that blood pressure.
120/78.
Okay, the patient's blood pressure is 156/100.
Okay, so our blood pressure is high enough to where we can give some the prescribed nitro. So do you know how to take your nitro by yourself? Okay, so we're going to assist the patient in taking the nitro. So on the bottle it tells us that we just need to spray it into the patient's mouth. So we're going to spray it into their mouth, underneath their tongue. Okay. So let's see what else. Okay. Can we take what's our pulse here?
Your pulse is 98.
What was that one more time?
98.
Okay. Let's see. And we're gonna count our respiratory rate by resting our arm right here. Okay.
Eventually you'll get 16.
Okay, great. Let's see.
Can we get a blood sugar?
You have 96.
Okay, so our blood sugar is high enough.
And the third SpO2.
98.
And then we're gonna retake our lung sounds again. So what's our lung sounds now?
They're clear.
Okay. And then we want to redo our primary assessment. So I think the ABCs are still under control. Let's see. Anything else before we start wrapping things up, Kimberly? No.
Primary, repeat relevant vitals. How
Okay.
often do you want to reassess?
I'm going to reassess every 5 minutes because I feel like our patient isn't that stable here.
Okay.
So we're transporting.
We're
Let's
going to
see.
check our intervention. So our initial SpO2 was 91%, and we're currently at
Right.
98. So our oxygen seems to be working.
Okay.
And then, do you want us to ask Bridget how she's feeling?
Yeah, sure. So how are you feeling now, ma'am? Are you feeling any better?
I'm feeling fine. I don't know what's going on though.
Okay. Yeah.
Do you know what's going on?
You know, I can't really give you a diagnosis right now. We're getting you to the hospital so they can help you out more there, okay? Right now, all I can say is that we've just given you some drugs to help with that chest pain, okay? All right, great.
What's your field impression?
So we're gonna just have a field impression of angina here. And we're gonna be transporting, and I think we're gonna give our verbal report here. All right. So we're going to call into Northwestern's ER. This is Unit 604, coming in with a 64-year-old female with complaints of chest pain and sudden shortness of breath. She is alert and oriented, but had regular or rapid respiration rate and pulse ox of 91% originally. We gave her aspirin and assisted her with her nitroglycerin, and we also put her on a non-rebreather at 15 liters. We are, let's see, her original set of vitals was 156/100, 98 beats per minute with 16 respirations. Lung sounds were clear, and blood glucose is at 96. So our SpO2 came up to 98%, and she's starting to feel a little bit better after the treatment. So we'll be there in about 5 minutes. Anything else to add, Kimberly? All right.
Thank you.
So, end scenario, how would you provide feedback now to the students?
So at the beginning, I think you should be a little bit more clear on what the team lead has to make decisions over. Important things like transport decision, respiratory distress, shock. I know Kimberly jumped in and tried to help you a couple of times, which was fine. And then you missed a couple of things here and there. And then the order that you went, I would say that after your primary assessment, you should go into your history, and then your focus secondary shouldn't go until after the history. Following the secondary vitals and then the reassessment. Also important to ensure your partner caught you on this, which was good, but to make sure that you check for the contraindications for medication before you administer or you help assist with it, because that would have been a critical fail had you given the nitro without checking for the patient's blood pressure beforehand. Yes.
What kind of angina was it? He didn't specify.
Right, unstable angina.
Unstable angina. So what's the difference between stable and unstable?
Unstable is just constant pain. The patient was resting, so it isn't provoked by exerting themselves. It doesn't go away by rest either. Stable, if they're exerting themselves, they're doing something like exercise or something, and then they stop, the pain will go away when they rest.
Okay, cool. Do we ever call it a heart attack?
No.
That should be a resounding no from everyone.
No.
No. Thanks.
No.
All right, end scene.